I was diagnosed with mitral valve prolapse. It caused me to be tired constantly. I would have trouble breathing. It compromised everything that I did. I really enjoy walking, and that's one of the things that I missed for quite a while. So, my name is Paul Powers. I'm 57 years old. I'm from Lombard, Illinois. About 13 months after my first mitral valve repair, I noticed the shortness of breath was coming back again. I came back in to see Dr. McCarthy, and as we had discussed in the beginning that, there would be some challenges with trying to repair it, and we decided at that time it was time to replace the valve. I enjoyed many years with my mitral valve replacement. And then in December of 2015, I noticed that I was getting tired again. I could not walk as far as I had been walking. We found out that the valve was failing again.
Mr. Powers is a very special case in that he's had already 2 previous cardiac operations, both initially very successful, but later on went on to fail. We thought that a valve-in-valve procedure would be a very good procedure for him, especially because it would be a difficult reoperative procedure. I'm Chris Malacery. I'm an attending cardiac surgeon at Northwestern Medicine in downtown Chicago, Illinois.
The biggest point for me was the Northwestern put me at ease. They explained the whole process to me in a way I could understand it. You go from the doctors down to the nurses to the support staff. Everybody was there for you. They were there to answer your questions. One of the nicest things about the transcatheter valve is there was no breaking of the sternum. There was no incision on my upper body whatsoever. For lack of a better word, low impact on my system.
So the procedure, valve-in-valve procedure, refers to a transcatheter heart procedure. In these cases, patients have a previous surgical bioprosthetic or tissue valve in place, which has unfortunately failed. And instead of doing repeat open heart surgery, we can do a transcatheter procedure, much like a TAVR procedure, where we go inside the artery and place a transcatheter valve inside the old surgical valve.
Valve-in-valve was hands down a much easier operation on me and on my recovery.
Mr. Powers is doing great. After the initial success with a transcatheter valve-in-valve procedure, he was discharged to home after a very short period of stay in the hospital and returned to normal activities in a very short amount of time.
For me, since I've had this procedure, my life has changed dramatically. On Sunday, I walked 4.5 miles. So, to have a procedure done on March 31st and to be able to walk 4 miles, my goal was by Labor Day to be able to walk 4 miles again. And on Labor Day, I made that accomplishment. The biggest part of having a valve-in-valve, and what I would suggest to other people, is to talk with your doctors, to listen to what they say, to take notes. Educate yourself on the procedure you're having done.